Hey, thanks for listening to our podcast today. I'm here with Maddie Duke, Grace Whittle, and Adriel Kirshner to discuss some of the information about pregnancy, delivery, and the postpartum process. Leading up to your delivery, what becomes so important is proper education and nutrition. Nurse Bethany McCarroll and I have discussed her research on natural deliveries, and she emphasizes that this is a 9-month process. If you were going to train for a marathon, you'd research where to start, what to do, and everything you may need to know for the big race. Having a baby is the same way. You need to research and educate yourself for the process. What should you eat? When should you sleep? Should you work out? Bethany raised some really relevant topics to my attention, and I dove into research for better information. An article by the Journal of Perinatal Education stated, education can help mothers feel in control, relieve anxiety, decrease pain medications and medical interventions, and empower couples in their transition to parenthood. Educating yourself first is super important, and attending classes can help. There are a variety of classes available at local hospitals, and we have attached some in the link to the video. In addition to education, McCarroll has also emphasized nutrition. If you're doing a natural delivery or a hospital delivery, you need to eat well. Movies and shows tell everyone that when you're pregnant that you can just eat whatever you want, when in reality, hydrating and proper nutrients are crucial. Folate found in beans serve as the building blocks for healthy development of your baby. Before entering the hospital when you go into labor, all I can stress is that you have trained for your personal marathon and educated yourself about delivery and your hospital's practices, which Grace is here to speak more about.
Thanks so much, Sadie. So, like Sadie was saying, when you get to the hospital and it's time for your birth, it's really important to have that education piece under control. And another reason why it's important to have a plan for what you want your birth to look like ahead of time is the way that hospitals augment labor, especially when it comes to the drug Pitocin. Pitocin is a synthetic form of the hormone oxytocin, which is something that the body naturally produces to accelerate labor. The goal that doctors have when giving you this is to accelerate labor when it stalls or just isn't moving forwards like it should. The problem with this medication is that it can often be hard to determine when a laboring mother is in true stalled labor. While prolonged labor happens in about 10 to 15% of laboring women, however, the actual percentage of patients who receive Pitocin is estimated to be around 30 to 90%. This issue is widespread and can result in increased morbidity and mortality for mothers. Not only that, but these decisions are often made without the consent or involvement of the laboring women involved. This issue is why I talked to my expert, Amelia Parker, who is a nurse at Floyd Hospital with many years of experience coaching birthing classes in England. Her and I talked about how much of a need there was for women to receive education on taking control over their own birthing experience and being able to make informed decisions on the medications and interventions they receive. This education doesn't just extend to labor augmentation, though. It's also important for what happens to your birth, which is where I'm going to turn it over to Maddie.
Thanks, Grace, for that awesome information. I'm going to be kind of talking to you guys about just the natural methods of childbirth. I interviewed Rachel, who is a midwife in Marietta, and she gave a ton of information on what that's like. She has her own personal experiences. And more specifically, I really talked to her about water births and what the benefits behind those were. She kind of talked about that they were able to relax mom, relax baby, and the baby has a really successful transition because humans in mothers' wombs are water beings, but when they come out, they're transitioned to air beings, and so the transition in the water is a lot easier on baby, seems to be a lot less stressful. The tearing also reduces in moms that have water births just because of the fact that your skin is soft, it's relaxed in the warm water. She also said that she sees a lot of moms become more relaxed through these water births, which I think is awesome. And she feels that mom and baby are able to really bond and rest immediately rather than in a hospital setting. Sometimes baby can be swooped away to have all of these tests and medicines done and really lose that immediate time to bond with mom, which I think is awesome.
Thanks for that, Maddie. Another key angle when approaching this is that these interventions won't just affect the mother during the labor process. The postpartum stage is often overlooked and not considered as much in the weeks leading up to delivery, for obvious reasons. But the entirety of a mother's life will be completely preoccupied with her recovery for well over a birth. In light of these interventions, a key thing that my expert Danae Kirshner pointed out is that for every intervention implemented, there are more and more risks for additional side effects, whether that be a spinal headache, CNS depression for the newborn, or a mental detachment from the labor experience. The effects of a medicated birth can have serious consequences. There are already lots of things happening to the mother in her postpartum period. For one, she may undergo serious times of depression, her body is getting used to lactating, and on top of all that, she's being woken up at all hours of the night by a screaming, hungry baby. When a mom is going through all these changes, it can be incredibly detrimental if any of her interventions have a side effect. My expert Danae pointed out that our ultimate goal is for the best outcome for mom and baby. That may come in many forms, in many ways, but it really boils down to, as Sadie said, proper client education and advocacy. If we can ensure that our clients are well informed and emotionally prepared for the experience, then we will have best prepared them for not only the labor experience, but also for the recovery stage.